is a real life scenario. We have patients that come in every day that give us hard restrictions on their shoe wear. They say, I cannot wear any shoe except blank, and I can only wear my orthotics. I can only do this.
And I can't go barefoot because those are all red flags to me. We're treating pelvic pain, low back pain, hip pain, and we haven't even talked about the foot with them, but they are specifically saying they can't do XYZ because these are the shoes they wear. That's a red flag to us that we need to dive into the foot and we need to get into the bottom of why you can't wear whatever shoes you want to wear, do whatever.
Good. This is a foot analysis of my dysfunctional feet. So the foot that we're going to assess, I dislocated my metatarsal tarsal joint in high school. I have a lot of pain in my arch if I'm not strengthening appropriately. And then I may or may not have broken my foot this past spring, and I definitely didn't rehab it appropriately. So here we go. So I have my patients march in place. I'm looking at what they're doing here. March in place.
And so we're looking at what the foot and ankle do when it's in a single leg standing, weight bearing position. Is she able to stabilize or is it falling in and moving a ton? Go to the other side. And we can probably have her slow this down and watch what the foot does. And now turn around and face the other way. Because sometimes it's easier to assess from the backside too. Good. Switch sides. And so we're looking here, see how she rotates out a lot to overcompensate for the weakness of the foot. So we're wanting to make sure the toes can stay active and support that arch being built here. All right, back down. So we will sometimes load. Is this going to go through exercises or are you just looking at assessment still?
Oh, we can do both.
Okay. If we see some discrepancies, the first thing is do they move the same? Do we notice one side is moving less than the other or excessively moving compared to the other side? The first thing we want to assess range of motion. Is one limiting range of motion versus the other side? If that's not the issue, are we over moving? And so do we need to develop more stability in that side so that we're not compensating up the chain in the areas that she spoke earlier, the gastroc, up to the knee, up to the hip? Where is the movement either lacking or excessive? And so we want to address those discrepancies with our strengthening program that we're going to initiate with the patient.
The first thing to assess is the splay. So if you cannot splay your toes out, which my left side does not do a very good job, specifically compared to the right, because I dislocated this foot, number one, I recommend either toe socks or some sort of toe spreader.
The other thing too is I can sometimes put like a band to facilitate some stretching. Put both your toes in. There you go. And then this right here is going to help both toes stay wide. And then we would do something active to facilitate the toes staying apart. So the first thing we would look at is the toe range of motion, being able to get that space, because if we don't get that, then we'll never get the feet to fire and activate like we need to in the single leg or any weight bearing positions that we need. So go up on your toes. Good. Keep your toes down. Then back down. And then back up. Try to keep these two down. Good. And then back down. Good. Now face the blue wall. Good. Widen your feet a little bit more. There you go. Now go up on your toes. And so we're doing things that are corrective at this baseline. Like don't roll out to your outside. Just straight up. Good. And slowly down. There's a ton of things we're going to get into as far as this is just range of motion. We can work on eccentric control, but putting the feet in different positions, and it starts with the toes and how we're going to fire the arch, how we're going to make the foot and ankle stabilize throughout range of motion and movement.